as you referred to page 13 of your slide notes, now we will talk about the third trimester. Now, the third trimester is considered at week 28 to week 40. Now what we've done again here is we've just left the slide blank, so if you'd like to listen and fill it in. Now, once again, reiterating that these conditions can occur in the mother during the third trimester of pregnancy, but they don't occur in every single pregnancy. The first one we'll get you to jot down is a shortness of breath. Now, once again, as the mother gets larger, the uterus expands further, puts more pressure on the diaphragm. What we would say is that you get your clients to really focus on breathing techniques. Okay. Number two, I'll get you to jot down is fluid retention or edema. Now, with a decrease in venous return due to the effects of relaxin, we mentioned earlier that it's increasing again, coming up to labour time. With the increase in relaxin, it can lead to a swelling of the feet. So what we would say with this, if your client does suffer from this, is muscle pumps. We talked about them earlier, really important. The calf raises. Water-based exercises can help because it takes the pressure off if they are suffering from fluid retention. Number three, because it is so important, we want to mention once again, there is additional relaxin in that system. It's preparing them for labour. Okay? So it can increase lower back pain, for example. There's a higher chance of varicose veins. All the conditions that we mentioned in the first trimester, just be aware of it, a higher chance of strains and sprains. So bring your exercises back to 70%, bring your stretches back to 70%. Number four, we'll talk about here is varicose veins. Once again, with an increase in venous load, make sure you get your muscle pumps in there. Incorporate them in if they are suffering from varicose veins. Avoid them standing for long periods of time. Okay. And what you can prescribe once again, or recommend, I suppose, is pressure socks, things like the skins on the calf region. Number five, now there's obviously an increase in frontal load. Okay. So what you've got to bear in mind is that you need to readjust the posture. Make sure you're strengthening the medial rotators and avoiding any external hip rotation. Number six, just make sure that you are preparing your clients for labour. So help them relax, don't tell them horror stories. Now is not the time for that. As I said earlier, make sure that they are clued up on breathing techniques, and things like meditation can help. So, implications of the third trimester to your exercise program. Slower movements, so your mother's going to be tired by this stage, so a focus on breathing is really important. Make sure you're not putting your client off balance. The centre of gravity changes quite dramatically in this third trimester, so you wouldn't be getting them doing single leg step-ups, weighted single leg step-ups, because the chance of them falling and causing abdominal trauma will be higher. And bear in mind that their posture is in an unnatural position, so they could be quite kyphotic, lordotic. So again, putting them in these situations where the balance could be compromised is not advised. If you're not already, you should be avoiding abdominal work. You should be avoiding overhead pressing, and you should be avoiding them lying flat on their back on a hard surface for longer than 2 minutes at a time. And once again, just for the third trimester, we've got how the baby is developing slides for your information.